What's up, guys? Welcome back to the True Sports Physical Therapy Podcast. Today's going to be all about clinical education. We have made a very strong push here at True Sports to bring in as many outstanding physical therapy students as possible. We get into those exact numbers, how you can be a piece of our clinical education programming. Our Clin Ed program is run by Dr. Rachel Knobel and Dr. Christie Chiesa. You're going to hear from both of them today. Dr. Knobel graduated with her doctorate of physical therapy from University of Delaware in 2020. She then went on and did a sports residency through the UD program, finished there in 2022, and then joined us and really started to build out this program. This program was started by Dr. Christie Chiesa. She graduated Pitt in 2020 with her DPT. Then she stayed on, did a residency there in sports, and now also is an SCS. And so they are our clinical education directors. They built out this unbelievable program with an outstanding curriculum. They talk about how you interview to become a student here at True Sports. They talk about how you are successful as a student. And we have had about 50% of our students actually be hired and stay on here at True Sports to provide the absolute best care to the absolute best athletes. So it's a great conversation. I wish a program was like this around when I was going through graduate school. If you're interested in applying to this program, just reach out to us. You can even send us a DM, True Sports PT on Instagram. And we are just trying to set you guys up to succeed in the field. If you're already a PT and you want to learn how we do it, we have a slew of continuing education courses, including an upcoming in-person ACL course here in Baltimore, Maryland, in one of our outstanding facilities in Bear Hills. That's going to be taught by Dr. Tim Stone and Race Hauser, who's both of them have been on the pod before. Make sure you sign up for that. Let me know what you guys think of this conversation. Without further ado, here's my conversation with Dr. Christie Chiesa and Dr. Rachel Knobel. Welcome back to the True Sports Physical Therapy Podcast. Dr. Christie Chiesa, Dr. Rachel Knobel. Welcome back. I've had you before, right, Christie? Never had Rachel Knobel. Okay, you nervous?
No, we're okay.
Okay, awesome. I'm having you guys on today because you guys are in charge of our clinical education offering throughout True Sports. Just a warning, I will call it continuing ed by accident, but I mean clinical ed. You guys have done an unbelievable job of getting students in the doors at True Sports Physical Therapy. Walk me through about what makes your program here at True Sports different than all the clinical education offerings across the country. Let's start with you, Christie Chiesa.
I would say that we especially pride ourselves, given both of our experiences, having done a sports residency and the mentorship part of it. I know some of my classmates, even me in the past, you don't know what you don't know, and our mentorship and it being a little more organized with our curriculum allows people to learn things that they may not have even thought to ask before. We also emphasize a lot of evidence-based treatments. We have students and their CIs read journal articles ahead of time to make sure that they're prepared going into clinic and with their mock cases. And definitely just access to a higher level population. That there's nothing wrong with some of the rotations that work with professional teams or work with college teams, but sometimes the students are a little limited and they're not that first point of contact. We see a lot of high-level athletes, and the students get to be with them from the start of their care through the entire plan of care versus them just coming in every now and then to do interventions.
Yeah. Now, where did you get the idea of, where did you get your structure that you have at True Sports? Where'd that come from?
Honestly, based on my sports residency, the way it was organized was very similar.
Where was that?
It was at in Boston with Massachusetts General Hospital and Northeastern University. So we had it on a much larger scale, structured with certain journal articles covering different body regions, different topics of types of athletes, depending on where we were in that time of year. And it really, I'm sure Rachel can attest as well, made me 10 times better of a clinician in that short amount of time. So trying to make that in a smaller scale for students so that they come out better than anyone else in their class when it comes to sports VT.
Yeah, and I get this question all the time as to, should I do a residency? Should I just come in as a new grad? And I have found that residencies across the country, they really vary in terms of their level of oversight. Sometimes you sign up for residency, you get in, and it's not all it's cracked up to be. You don't really see, let's say, doctors or PTs as mentors. You're kind of on your own. Sometimes it's outstanding, kind of like what you're describing. So I think it's really hit or miss. I love that you pulled from an outstanding residency experience. Dr. Knobel, kind of chime in on some of the things that you have noted that are in the true sports clinical rotations that maybe you wish you would have had necessarily in your residency or that you think are important to highlight.
I think one thing that's unique about the True Sports clinical education program is just kind of what Christie mentioned of we have access to so much in terms of gym, turf, and all of the tools that we need to provide a high level of care to an athlete at end stage of rehab. I think that was something that was challenging to find in a typical residency program.
Yeah.
So I think we are unique in that we are truly table to turf. And I would say 99.9% of the students who walk in the store have not seen that before.
Yeah.
So that's something pretty special to offer them. We've done Zoom calls with students to just kind of explain the program and interview them and see if they'll be a good fit. And usually I flip my camera around and I show them the turf in the back in Glen Burnie, and they're like, oh, like you really do have that.
Yeah.
So I think that's something that's really, really special about what we have to offer. And Christie mentioned the journal articles and all of those pieces. That's something that comes from our residency programs. But I think the true sports spin on it is, okay, this is late stage.
Yeah.
What do you do?
Yeah. Yeah. And I think that's such a missing piece. It's definitely something you get here. Okay. So you mentioned you're doing Zoom calls with applicants. Walk me through the life of a clinical rotation here at True Sports, all the way from application at the school to when they hit you, and then what happens?
Sure. So the first step is the students will receive from their schools a list of sites that the school is affiliated with. For the schools that we're affiliated with, those students see us. Usually they look us up online. Maybe they listen to the True Sports Pod, follow us on Instagram. They're like, oh, I want to apply to here. So we have them submit their resume and an application that includes strengths and weaknesses, personal sports background. Were they an athletic trainer? Were they a strength coach?
Hold on. So they find out about us, they being the student. They hit their clinical education coordinator at school, and the school reaches out to you? How does that work?
So Christie might be able to speak to the initial process a little bit more, but they express to their school that they're interested, and then the schools have varying different processes to allow the students to apply. But the school provides the student with the application that we've given them.
Okay.
The student fills out that application, and then either the school's coordinator sends that back to us, or sometimes the students will send that back to us. But that's resume and the application.
Okay, now I got myself in a lot of trouble when I was in graduate school trying to find outstanding rotations for myself. My school was like, that's not your job, that's our job. So can a student do this and reach out to their school, reach out to us? Does it vary? How does that work?
We have some students reach out with interests, and then we've had schools form affiliations based on a student's interests. I think that varies from school to school.
Okay.
So I think it just depends on the individual circumstance there.
Okay, so think about from the consumer end. Someone's listening, hopefully, to the True Sports Pod. They're like, this is where I want to go. What should they do?
I think they should reach out to their school's clinical education team, and they can reach out to us, and then we can try to form a relationship with them.
Okay, so if you're in the middle of Idaho, you're listening to our pod, hit us, True Sports PT with a DM on Instagram. We will then try to set up an affiliation with the school, or they can go to their CCCCEEE and they will reach out to us. Okay, then we have an application process. Okay, so we get their resume. We set up a Zoom call, right? What are you asking them on that Zoom call? What's that interview process look like, Chiesa?
Often the Zoom call is getting their general background, some of the cliche questions, why do you want to be a PT, but then really going into their strengths, their weaknesses, expanding on some of the topics that we cover in the application that allows us to get to know them more than just looking at a resume. We ask about their previous experiences, what they liked, what they didn't like, things that they haven't had exposure to, their long-term goals. One thing that we started asking also to really emphasize the importance of communication, we ask 3 different scenarios. All have low back pain, a 9-year-old phenom gymnast, 16-year-old male laxbro and a 75-year-old boomer with low back pain. How do you communicate to each of those people? What makes each one different in terms of what you have to consider for education, buy-in? We've started to ask things like that a lot more to really emphasize the importance of the communication skills and get them to self-reflect, whether it's at that moment and then moving forward.
Okay. And they get those questions before the Zoom call. So they're prepped or no? Okay, so now they have those questions. That's great. Talk into the mic and tell me, what's an awesome answer and what are some crappy answers that you've heard?
An awesome answer is, if we're talking about, you mean in the situations of the patient?
Yeah.
So 9-year-old gymnasts talking about the importance of simplifying language, speaking to them individually, not just like they're a baby, making sure you're directly talking to them and not just always referencing mom and dad, including mom and dad in the education, but making it all about the kid. What do they love doing? How are you making it fun for them? How are you making it so that PT is cool and they want to do their exercises? And how does it relate into the things that they want to do? 16-year-old laxbro likely can be a little more intense, but still trying to match their personality, asking them about school, asking them about their life outside of sports, making sure that you're educating them appropriately, and how will this help them to get to their Division I college that they're committed to. Then 75-year-old male, sometimes we found it common that they like to tell stories, talk about their grandkids and their kids. How are you helping them to feel more comfortable, and then relating everything into, this is so you can carry your grandkids around. This is so you can walk in the park with your daughter after she's done with work. Really getting an idea of more than just the clinical skills. Anybody can say clamshells, anybody can say single leg balance, but how are you making that different? How are you relating it back to what they want to do?
Yeah, love that. Okay, let's stay on that interview process. Rach, what else are you looking for through that conversation?
So I think no student is going to have it all, right? And that's why they're a student. We added in some questions to our application process based on students who really excelled and students who didn't. So the communication was one big thing. Like, can they fill 45 minutes of time with not just clamshells and balance and whatever exercises they choose, but can they make a genuine connection? So that's the communication piece. We've also found that because this is such a demanding clinical, if they're lacking ortho skills and sport skills, they're just going to tank. So we're looking for something in their background that tells us they're comfortable in the weight room, they're comfortable around athletes. And that doesn't necessarily mean that they need to have been an athletic trainer or need to have been a strength coach. It's mean that they were a D1 athlete and worked hard and understands that hustle and understands the team mentality and that kind of drive. So
or an athlete, as a non-D1 athlete.
Absolutely.
Which there are two of us in the room, right? Okay, there are two of us in the room. We could still do this, right? Okay, I don't want to dissuade applicants. Okay, so you're looking for some type of sports acumen, comfortable around the athletes. And then clinically, you said some of them have ortho experience, some of them have sports experience, some don't have either. Anything else that are kind of musts that you're thinking about that you're looking for?
I think you know this, but true sports is hard work. It's a grind. We want to provide the absolute best level of care to our patients. And if you're a student, it's going to take you a little bit longer to do that than it would a clinician who's been doing this for a little bit longer. So I think just that willingness to, hey, it's not a 40-hour work week. It's probably going to be time at home. You're probably going to take a note or two home. You're probably going to be doing research, the journal articles that Christie mentioned, and any other outside research that the CI might ask at the student. The student who says yes to all of those things is a student who's going to thrive. The student who isn't willing to do that or doesn't want to do that tells me that they might not be wanting to be in the sports world.
And, I've seen to varying degrees how bought in our different students are. So we'll get students. I remember coming into Glen Burnie and seeing a brand new face. It turns out she was a student that was working in Frederick, but she took it upon herself to kind of come over here. And that's part of the curriculum, some of this crossbreeding. So talk about pieces of that curriculum that I think are nuanced and different, because not every rotation you get is going to be a multi-clinic company. So how do you kind of leverage that to make for a better offering to the students?
We really try to make it so that we're utilizing all of our clinicians, even if they're outside of that individual specific clinic. We have running experts. We have areas with force plate testing, such as Glenn Burney here with Rachel. I treat concussions. We have overhead experts. We want to make sure that even if my student isn't at Rachel's clinic, but they want to see force plate testing, that they have access to that, and at least for one day can go shadow and see how that looks in live with a patient. We like for people to do that twice. If they do want to do that a couple more times, we can discuss that. But preferably, we like for students to do 2 niche areas of PT as exposure. And we also like, beyond just the niche specialties, for students to see how does it look to be a PT outside of the clinic? How does it look to advocate for your profession outside? How does it look to be there on the sideline of a lacrosse tournament and randomly have to market yourself to so-and-so's parents, hurt her ankle? How does it look to talk to doctors, to do an ACL injury prevention program with a high school soccer team? We like for them to also do a couple experiences there so that they can see it's not just in the clinic, especially as sports PTs and especially as private practice. We have to go out, advocate for ourselves, and that it is possible even if you aren't an AT.
Yeah, that is really awesome. I wish I would have had something like this. So good on you guys for putting this together. Then talk to me about inside the clinic. How do they ramp up once they come along, once they're accepted? How do they ramp up treating? And then also, how do they prepare before they even walk in the doors? Knobel.
So I will use kind of like a 10-week model as an example. All the rotations are different lengths. I would say we don't like to take students for anything less than 8 weeks, just because we found that it takes a little bit of time just to get your feet wet in the setting. But the ramp up is a little bit intuitive when you kind of break it down. The first day, I usually have my students come in, get to know my patients. Can they talk to them? Can they form a conversation? Can they form a relationship? Click. Do they generally know what they're coming in for? Then based on kind of how they do with certain patients, I'll start giving them patients to prep for. So maybe they meet somebody on Monday, and then on Wednesday, I'm having them Tuesday night going home, doing a chart review, preparing a session for Wednesday, wherein I'm sitting there, I'm still there, but the student is leading that session. I might do that for maybe 2 to 3 patients a day on the back end of that first week. Then maybe come heading into that second week, 2 to 3, wrapping up 4 or 5, and then gradually progressing to as full of that 10 to 11 patients a day caseload. It's a little bit dependent on just kind of which patients they do well with independently will determine how quickly I step away and allow the student to lead the treatment.
Yep.
But it's something to that effect.
And then, okay, so that's an awesome ramp up. And then what kind of research work are they doing on their own?
I think it depends on the patient case. So if it's somebody who's been here for a while and it's a post-op case, I might kind of quiz them a little bit. I might be like, hey, so-and-so is, almost 3 months out from their ACL surgery. What do you think is our next step? And I'm looking for that answer of, well, have they started running yet? And are they getting close to that? And I'm like, okay, well, how do you know if they're getting close to that? Looking to see if they're thinking, oh, maybe we need to do objective testing. And that's just kind of questioning their clinical thought process on that patient a little bit to get a sense of where they think they should be. And then I'll fill them in a little bit on, yes, they're on target, or no, they're behind target, and this is why.
Yep.
And then based on that, I'll have them consider what types of interventions they want to do. I usually have them prepare something for me, and then we'll break it down and talk about it, either in a mentor block where I'll have them come in a little bit early to chat and make sure they have a good game plan for the session ahead.
And then they have journal articles that they're reading along their entire process. Where'd those come from? How often are they? And what do you do with them?
So they're broken down by body region, which really can be tricky in the sense that we can't control what they're going to see in the clinic on a certain week. We do know that we see a lot of knee patients at True Sports, so we typically have the CIs, and it's ordered in this order, but it starts with knee for that reason. And
Starts with knee, is that what you said?
It starts with knee.
Yeah.
And it starts with, there's an ACL CVG in there, and there's a few other articles specific to ACL. There's also some articles about patellar tendonitis as well as patellofemoral pain. So a lot of those common diagnoses get hit on in week 1. So those journal articles are meant to help facilitate discussions between the student and the CI on common topics and things the student might know but not really know.
Yeah.
So I think it opens the doors for, hey, here's a mock case, here's a patient, day 1, post-op ACL, go. And CI sits on the table and the student has to run that mock case.
Yeah.
We also have one that's a little bit of a differential diagnosis case of patellofemoral pain versus patellar tendinopathy. And those are meant just to kind of get the student thinking about those pieces. So
working through those with their CI at what interval? How often are they doing that?
Each week, we require 2 mentoring slots. So each one's 45 minutes because normally it's throughout the workday. So that's an hour and a half total. It is normally in that first mentoring session that they end up doing the mock case where the student's doing the clinical skills, seeing where they're at, and then they debrief after. So each week, since we do switch from body region to body region each week, that ends up being about 45 minutes at least to do the actual mock case.
Yeah.
And then you would go into a little more in depth along with return to sport interventions in that second mentoring slot.
That's awesome. And then by the end, 8 weeks, 10 weeks, 12 weeks, they have a full caseload. What are you aiming for with that? You mentioned 10 to 12 a day, potentially. Are they doing that for a whole week? What's that last week, 2 weeks look like?
It's very dependent on just kind of availability at individual sites. So a absolute rock star student who, absolutely crushes it could do that last week. Maybe they see 10 a day for that full last week. I will say that in this type of setting for a student, I would be happy with them seeing 7 to 8 and absolutely crushing the care of those 7 to 8 patients. I care a little bit more about that than them hitting the full 10 to 11.
Mm-hmm.
I frame it to them as if I can get them 1 or 2 days with the full caseload so they can appreciate what that feels like. I think that's important. But to me, I'd much rather they get the learning objectives completed and they see 7 to 8 patients than I just throw them patients for the sake of volume. That's something that Christie and I both talked about. Where in PT school, we've had students and classmates be like, I saw 17 a day.
Yep.
How many did you see? And I'm like, not 17 a day. I don't want that. That doesn't sound fun.
Yeah.
So that was something I actually had in my last clinical experience at CI, who kind of sat me down in the beginning. And I was like, why are you only having me see 3 patients? I can do more. And she's like, I really can do more, but I want you to do these 3 really well.
Mm-hmm.
And you're not here to treat patients. You're here to learn. And that resonated with me and that stuck with me. And that's a mentality I carry forward with my students as well.
Yeah, that's awesome. What are some of the pitfalls or mistakes you see from students, and how can they avoid them as they move through this curriculum?
The biggest thing I would say is the very important thing is for people to reflect on their own strengths and weaknesses beforehand and to really hone in on not just the clinical side of things, but the interpersonal side of things. One thing that I often say in our interview is we've seen PTs who definitely may not be the smartest in the room, but if you can talk to people, you can have those interpersonal skills, that's everything. So similar would be the smartest student in your class, and some of them, I would not want that to be my PT. So definitely the students who recognize the importance of developing those interpersonal skills and trying to connect with those patients versus being stoic, a little afraid, a little standoffish with patients. That's really the most successful students that are able to do that. Also, students who may not look into basic strength and conditioning principles before they come in to find us. Rachel and I have tried to use our buddy Ray, shout out to Race Hauser, to make a summary, a 20-page summary in his case, the strength and conditioning principles. Because we have had that be something that's more challenging for students to get better at, which is understandable. But you can definitely tell which students do not do their research ahead of time, and it's a tough environment to come in from a general orthopedic side, let alone when a Division I recruit, senior in high school, comes to you and you're supposed to take them all the way through their ACL. So you can tell a lot by students who haven't done their research as much on these strength and conditioning principles.
What do you see? What are they doing wrong?
Some of the typical very basic exercises and not knowing how or when to progress or regress. situations where they're not organizing a session appropriately. They don't have a goal in mind, and then they're just kind of throwing things at the fridge and seeing what sticks.
Yeah.
And also situations where they may not have the appropriate dosing in mind, which kind of goes back to the goal. But if you're working on power, why are you having them do 15 reps of dose? If you're working on endurance, why are you having them do 2-rep max with a ton of weight?
Yeah.
That's the biggest stuff, the lack of preparation, and then the lack of emphasis on the interpersonal skills.
Yeah. You guys are nailing the interpersonal stuff. And I love that because there's so much available in textbooks. And we provide that Racehauser guide to strengthening the shoe. Okay. So there's so much there that you can memorize and regurgitate. Those soft skills are really important. It sounds like you're really hammering that. As you mentioned, hitting on the interpersonal skills early, trying to test for them. How do you educate them when they're not getting it? You have a exercise savant as a student, but they're not connecting to their patients. What do you do mid-rotation to help them along that?
I think that's where some of the mock cases can kind of shift from, hey, what's the differential diagnosis here, to, hey, they're a 16-year-old girl and they just tore their ACL and they're crying in front of you.
Yeah.
Like, that's a human interaction. And
I need to take that because I struggle with that population. Tears, I struggle with tears. Okay, so girl cries, student kind of looks at them blankly. What's the teaching moment that transpires there?
there's a little bit of like pause, kind of you're in a clinical space, you're their provider, but you're also a person, like empathy, like what are they feeling right now? And just trying to get the student to kind of think about, you're not even going to be able to get to the exercises if you can't connect with the human in front of you.
Yeah.
I've found that if you just kind of get them to pause, like their brain's working 100 miles an hour just to figure out what's going on in the clinical space, like pause. Mm-hmm. We'll need you to figure that out right now. I take care of this first, then take a deep breath, and then go from there.
Yeah. Good advice. And that's really important. Now, how many students you have were in 2025? How many students are coming in 2025 to all of True Sports? That's my number one question.
Right now, we have nailed down about 30 to 35.
I think we're close to 35.
Yeah, and a lot more who are applying. So when I first took over the role in 2022, I think we had like 18. Mm-hmm. This is a huge growth for us, and we've gotten a lot of positive feedback, and some of the not so positive we've really been trying to improve in areas where students have struggled or identify weaknesses. But that's definitely been something that we see as a challenge moving forward, to make sure that it's about quality and not just quantity of students. So we interview everyone. We make sure that they're not just here because they like sports. We want them here because they're passionate. We really want to find a good spot for them, something that complements them with their learning style. That'll be probably our biggest challenge and goal moving forward, is to make sure that that quality is maintained, even if we have up to 45 to 50 students in 2025.
Yep. Okay, so with that many students coming in, how do you standardize their experience? How do you educate the CIs to provide a very similar curriculum?
So we provide the CIs ahead of time with the student curriculum, so they understand their expectations for these body regions you should be covering. These are the 2 mentor blocks you should be having. And then we also recently started doing a Zoom call with all new CIs and then any returning CIs who just want a review, where I will go through that curriculum, what that really looks like in the day-to-day, and then also just common pitfalls and experiences that we've had with students in the past, so that these new CIs can learn to anticipate those problems, such as we might get a student in the last rotation who's studying for their boards and they're having a hard time balancing the rotation with studying, or maybe they have some life circumstances that become challenging, making sure that the CI is aware of that, the CI and the student have that line of communication throughout. But I think the new onboarding procedures will be helpful for that.
Yeah.
We also have a lot of new CIs who are in spaces with clinicians who've been CIs before. We try to encourage those new clinicians to shadow with that person who is actively being a CI, see what a mentorship session looks like, maybe even have the student shadow them for a few treatment sessions, or if that CI is out for a day, that newer PT could be a CI per day, get some experience and some reps with the student and within the curriculum before they step into it themselves.
Yeah, that's really interesting because I think there are two pieces of an outstanding student experience. One is how you bring the student along. Two is how you bring the CI along. How are you finding the CIs? What is life like as a CI at True Sports?
We have, even before we finalize the rotation, after they interview with us, we make sure that the student interviews or has a meeting with their potential CI. So from the get-go, we make sure that the CI has a voice. Just because they're talking to this student, just because we like the student, doesn't mean that the CI has to say yes or that they think they would be a good connection with the student.
Yeah.
We put it in their hands to start with. Then once they say yes, we go through with it. CIs, like Rachel said, we have the handbook, we have the curriculum. The curriculum describes things like 2 mentoring slots each week. It describes certain weeks where we're checking in, where the CI should be talking to us, where we're talking to the students, making sure that everyone is on the same page. We make sure that we reach out and that our role is also to help schedule the niche shadowing experiences and be there either through text, email, in person, always a resource for the CI moving forward, so that it's very laid out, direct, they have guidance, and they aren't feeling like they're just swimming in circles.
Yeah.
To figure out that journey for the students, you make it nice and easy for them and standardize.
Yeah, that's awesome. Give me some, you mentioned like some of the pitfalls of the program or things that you wanted to improve. What was the feedback by and large that you're getting from students, both positive and negative, around this curriculum? Knobel.
I think the biggest positive is that students have not had CIs sit down for a designated mentorship slot before this rotation.
Yeah.
They're like, this is the first time somebody sat down with me and talked to me and break things down this much. So I think that's huge, and that's one of the biggest compliments we can get. And then when we get a student who wants to work for us, that's the ultimate compliment there.
Yeah.
I think some of the negatives are the students not recognizing how much work goes into this rotation, and then maybe being frustrated by the ask of, well, I'm here for 40 hours. Why am I doing more than that? That's actually part of our initial interview questions. Is we want to be completely upfront that there are going to be weeks where you are working more than 40 hours. Are you ready to sign up for that? And most of the times the students will say yes. Sometimes they hesitate, and sometimes they're honest. And I appreciate the honesty of, hey, I have this, and this going on in my life right now. I want to say yes, but I need to know that I can juggle all of these things. And I think those open and honest communication skills are huge as a student.
Yeah. I mean, like, I've seen students who have probably said, yes, I'm willing to do more. And then when they're in the clinic, all of a sudden they're like, I don't have time for this crap. So I think that pushing them early, almost like asking them to vet themselves to say, this is going to be too much, goes a really long way. Anything that you've seen or feedback from students that Rach didn't hit on?
One of the biggest things is the students just love that they're able to, which I alluded to before, those high-level athletes, they're able to take them through their plan of care. Obviously, the CI and the students, the understanding that the student is ready for that. Yeah. But I've had my students work with high-level D1 athletes, with professional athletes at times. Not that there's anything wrong with the rotations that people have available to them through schools that's with the Toronto Blue Jays or pro team. I just know, having talked to some students that go through that, that they aren't that first line of care.
They're just watching. Yeah.
Yeah. Or they get to do some things, but it's more coach reading and still that PT, that CI that they're with taking the lead. This often is the first or only time that a student really feels like they're being equipped through the mentoring and even like the niche exposure that they haven't seen before, to where they feel confident coming out having treated some of the high-level athletes.
Yeah. It reminds me of definitely some of the horror stories I've heard where it's like you look on the resume and it's like, holy crap, you worked with this team or you did that residency, where in actuality, once you dig in, that student is unprepared because they're doing co-treating or because they're watching more than they are treating. And I think that sets this program apart. It is bananas to see some of our students treating NFL athletes, to see some of our students treating Virginia and Maryland lacrosse players, one-on-one by themselves with the CI maybe overlooking, but definitely not leading. And then there's, to your point before, there's a lot of times where the CI is treating another patient. And if the student has proven their ability to treat independently, they're on their own. And that allows them to develop a real connection and be looked at as a clinician as opposed to being looked at as a student. And that is an unbelievable opportunity, because I think students come out and once they put on their big boy pants and they're the clinician, they've never really done that. You guys have provided an opportunity for them to actually do that here. It's really awesome. What else aside from the hours worked have students said, hey, I wish this was better at True Sports?
There have been times that students and CIs, has also come from CIs, where they feel like the communication wasn't as efficient between the two of them.
Between CI and student?
Yes. And this is where Rachel and I have brought in the presentation that we get, updating standards of procedure for being a CI, so that we are there and that they feel comfortable coming to us if there's any misunderstanding, feelings of disconnects between where the CI thinks the student should be and where the student thinks that they are. Mm-hmm. That's something that we've really tried to integrate ourselves into, because we try to match everyone up like it's eHarmony, but that doesn't mean that it's always going to be butterflies and rainbows. And there's nothing wrong with them having some more challenging discussions. But if there is a little bit of a difference or an area that we need to come into to be that mediator, we're trying to be more present in the situation.
And I've seen that. Like, I've seen students come in, they were great on paper, they were really good interview, and they sucked clinically, or they sucked in the clinic, whether it be communication skills with patient or whether it be clinical skills. They're just not getting it. And credit to you guys, I've seen them grow in their rotation. So actually improve on the skills that they sucked at early or had trouble with early, and then later on became a strong point. Even going as far as then being hired here at True Sports. So really turning around, that's a credit to you guys, like taking that feedback and making this program next level. Because I think you do not get this a lot of places. I think my last ortho rotation, I got so pissed off because I was treating 3 an hour, and they would call the patient, they would call the therapist's name on a loudspeaker when the patient came. And I was juggling 3 patients from my 10 o'clock hour. 11 o'clock hits. Another patient walks in and loudspeaker, Yoni, come get your patient. And I'm like, that's not my patient. That's her patient, the CI. Why am I treating it? And you guys have really done a great job of giving the CI and the student time to prepare for the day so that that won't happen. Number one, we treat on the 45-minute. But number two, if the student needs to stay a little bit longer, the CI has the ability to pick up that other patient and really give the ideal learning environment to the student. It's really awesome. Okay, let's talk about grad schools. Where are these students coming from? And have you noticed a trend of great students come from a given school?
We've expanded so much that...
How many schools are sending PTs here?
High 70s, 80s.
Yeah. We have 84 affiliations as of right now. And when I started in 2022, there were 32, I think. We've gotten applicants from UT Southwestern, from Torrey University, Nebraska, Indiana State, all over. And these are affiliations that we just started late last year, early this year. So I'm sure that the amount of students from elsewhere will continue to grow. But a lot of these schools that we choose from, a lot of times NUSC, University of Delaware, Northeastern, Pitts, UMD, UMD.
University of Maryland, Baltimore. Yeah.
That's right. I always say it. Yeah, I think that's a lot.
Okay, so it's a lot of schools, is there, if you're talking to a college kid and they say, hey, I want to be a sports PT, where should I look for grad school? Do you guys have recommendations of what an outstanding sports prep program is?
Yes and no.
Knobel, answer the question, and you can't say Delaware.
That's what I was weird. I think my advice to the student would be look for a school that has a very strong orthopedic program.
Okay. How do they know?
You ask questions.
Like?
So you ask, who is teaching my orthopedic curriculum? Is it a professor who only does research? Is it someone who's an active clinician? Does the school have a sports and orthopedic site that the student can treat in? This was slipping off.
Yeah, it's tough when you have hair.
Does that school have like an attached sports and orthopedic clinic that the student gets to learn from treating clinicians in that site? The questions like that are going to help answer that.
I love the question. Sorry to cut you off. I love the question of, are the professors doing research or are they treating? And by the way, specifically, are they treating athletes? I think that's really interesting. So I think that's a great question for a college kid to ask their graduate program or whoever it is that's guiding them through. Any other things they should be looking for? How about affiliation sites? Like, it'd be nice to hear if the grad school has a rotation set up with a True Sports or with anyone that looks like us, which is no one. Anything else they should be asking or looking for?
I was going to mention the affiliation piece as well. Even if they don't have that affiliation, is that something that they're willing to facilitate for the student down the road?
Yeah.
And then where are your graduate students working? Like, when you graduate, what % are in sports? What % are in orthopedics? What % are in neuro? I will say that, yes, students should consider those pieces, but I also think that it's not the school that makes the clinician, it's the student. So that's not to say that, every program is the same, but every grad program is structured to have you pass your boards.
Yeah.
And the boards are not heavy on sports curriculum.
Yeah.
I think the boards are across, they're meant to test, can you work in any PT space? So that's first and foremost what the goal of a graduate program is.
Yeah.
So I think it's more the outside experience that the students creates for themselves. So
And okay, so what should those be? Because I went to a school that sucked at ortho and sports, I would say. Definitely sports. Also, if I looked at one more anominate rotation for my ortho stuff, you can see it, like, how far that went. But what do they do on the outside? How do they become great and prepared to be, let's say, a true sports PT?
So it's interesting because we get this question from students during the interview of like, oh, like, what makes a great student? Like, what can I do to prepare? And I think it's more the experiences than the tests, so to speak. So a lot of students are, should I take my CSCA before this rotation? And we usually answer, you can, but you're going to get a lot more out of finding a local strength coach at a college nearby, or even the school that you're attending for PT, or find an athletic trainer to go shadow, or go find a site like True Sports and go hang out there, learn about what it is to actually provide the care to those athletes. And even if you're not actively doing it, just forming those connections and seeing the spaces, I think, is much more valuable than sitting down and studying for a test.
Yeah.
And regurgitating that.
For sure, that's great advice. I would also add, in addition to, not in place of, I love applicants that have been in the service industry or hospitality industry. So if you tell me you are a waiter at a high-level restaurant, I love that. I mean, we are in the service industry, and like when you talk about those soft skills, that's a great opportunity to learn them and to own them and to perfect them, because that's a big piece, like you guys kept hitting on before, of what we do here. But you're right. I don't see that enough of students going out of their way and stepping outside of their curriculum to add experiences, to shadow, to spend time with different clinicians and stuff like that, in addition to their schoolwork. What would you add to that, Key? Is anything?
I would say, me personally, I was fortunate. I had a lot of good mentors around me, but from year one in our first summer hell week with trying to make sure that everybody's getting weeded out if they aren't doing their gross anatomy correctly, I I went into one of the top sports PTs there, Andrew Lynch, who's awesome, big knee guy. And I knew that he had connections. He had done residency. His wife had done residency. And I went up to him, knew for the most part that I wanted to specialize in sports and do residency myself, and just asked, what can I get involved in? What do I have access to? What if I wanted to start XYZ? And he was the one that allowed me to get hooked up with helping with the Pittsburgh Marathon. We started an adaptive strength and conditioning programs for amputees. All it takes is going, finding that one person who could be a great mentor, who has a solid background, and the people are more than happy to facilitate those relationships. I loved when students come up and ask me for advice, or if I can communicate to someone for them or connect them. All it takes is asking, and it's a lot less awkward than students think it is. Really getting out of your box and taking advantage of those around you, not just the local gyms, but if you have professors with connections, talk to them on day one.
Yeah, and like you said, it doesn't even have to be professors, although it helps. But I found myself in grad school without the professors around me. I was a manual therapy geek, but I found local privately owned practices to just spend a day, spend a weekend or something like that shadowing them to try to learn those skills. It's everywhere. It's rare you find yourself in a city without a sports PT or a strength coach, like you said. So just go and spend time. What grad school gives us the best students? Chiesa.
I would say racial tickle of us. University of Delaware students, then very solid. NUSC has been very solid. I know the Pitt students I've had have been great. And
so those are big. Those are big boys. MUSC maybe a little lesser known. Any lesser known?
LVC.
Think it's a great education.
Always half of our pizza.
That's true. That is true. And I think LVC, from what I've seen, gives you a good foundation. For whatever reason, their therapists interpersonally are outstanding. I don't know what that is, because I don't know if they're teaching that. I think a lot of them also are athletes from LVC, like they have the joint program. So I think some of them kind of go through and they're athletes at the same time. And that builds the ability to talk to people in a locker room of all different types of backgrounds. So maybe it's that. Okay, that's a good call. Any other schools that jump to your mind? And it's like, if I didn't go to Delaware, which is the #1 orthopedic program in the country, I should have gone to.
I think we had a nice crop of students from Rutgers. This most recent cohort has been very impressive. A lot of students who had taken initiative upon themselves to learn more. So they started a sports medicine journal club that a lot of them were a part of. So these students came in knowing how to research, and we were able to hone in on some other areas of growth for them. And I think they've been very willing to learn and put in the extra time. So I've been impressed with the Rutgers cohort, and Austin will be happy to hear that as well.
Yeah, that's a good call out. I've been very impressed with them. They've been really awesome. Shenandoah, we've had some good students, right?
Eastern as well. Northeastern, we've employed some of their past students. We have one now who's awesome as well. It's cool that we're getting them from more and more. I mean, Shenandoah, we didn't have a ton before. Now we're starting to see more and more of them. They've done phenomenal. So it's cool that we're starting to get different programs in here other than some of the usual handful ones closer.
And Northeastern they have a special piece of their program, don't they? Where they go out. What do they call it? Where they go
co-ops.
They're co-ops. What is that?
So what they do is essentially there's a brief break from their schoolwork, and they'll go and work for a certain amount of months or a certain semester at, honestly, a workplace that they're passionate about. So often with health and sciences students, future PT students, they'll go and shadow in a sports medicine clinic. They'll go and get connected with some gym and try to work there as aides. Yeah. But it's a cool idea. It's a cool idea for them to get exposure to the workplace while they're also in school learning the fundamentals.
Yeah.
I would also add St. Francis University. And then to circle back to Delaware, because I'll brag about my roots a little bit.
Yeah, go on.
Fine. One thing that I think Delaware does a really nice job of, and I think you spoke to it when you spoke of True Sports, allowing students to do the hair themselves. I was at University of Delaware for my graduate program, and they do integrated clinical experiences where you are running the treatment session as the student. So I had taken my basic musculoskeletal evaluation course, and then the next semester, or it might have even been that semester, I was in the clinic treating orthopedic patients, and I hadn't learned any of my orthopedic skills. I didn't have any of my manual yet, and I learned that from SCI, and I learned that from my experience working with patients, asking DPT2s. So the class bugged me, hey, how do you do a lumbar UPA mobilization? I don't know what that is.
Yeah.
And I learned that before I learned it in my curriculum, and I think getting those reps and those experiences, being the front line with the patient, is why the Delaware students are coming out so strong and so ready to even do True Sports as rotation number 1.
Yeah.
So that's pretty special.
That is special. I crap on my grad school a ton on this podcast. And I will say, some of the students and best hires we've had of late have come from UMB. And that's because they brought in some unbelievable talent, which was definitely not there when I was there, to treat their sports. And they're putting them in college training rooms. I think it depends who your CI is, but that and because of the volume that these guys are seeing in the training rooms, they don't have a choice but to let their students do stuff. So I think, it's come a long way. And I think as a whole, the educational system has come a long way, but a lot of that has to do with the private practice sector that you guys are doing. You're really pushing this forward. It's really awesome. So tell me about the future of clinical education here at True Sports.
We're really looking, as we're expanding, I mentioned before, focusing on the quality and not just the quantity. So similar to how we started the presentation for upcoming CIs and trying to mentor there, we want to make sure that we're also providing better opportunities for students to learn higher level concepts, using videos potentially in our curriculum for analysis of higher level biomechanics, being able to get on that side of treatments and move into a little more smoothly. The strength and conditioning principles is huge, so it can also help to bounce off of that. But I would say the higher level, making sure we're keeping up the expectations of the CIs, mentoring them and not just the students, and doing all of this despite growing in numbers, making sure we're not compromising education and learning of the student for treatment.
Yeah. And then we also, it's worth mentioning, we have our own in-house continuing ed. And so providing that material to the student at a discounted rate allows them to catch up as if they were already a PT, right? And so we have an ACL course, we have a low back course, we have an overhead athlete course, we have an Achilles course starring Rachel Knobel and Austin Kolish coming out. So we need a concussion course. So that stuff is also readily available. And has helped fuel the growth and the preparedness for our students to go on to amazing things, even if it's not here at True Sports. Anything in the future that you want to highlight, Knobel?
So you mentioned the continuing education kind of partnership. So that's something that we want to work with. That would be Dr. Gina Hiskey. Right now, we like to, as we're expanding the in-service offerings by current SAP PTs, we're looking to record those. And then those are opportunities for students to learn from PTs who are not at their level site.
Yep.
So I gave an in-service about the force plates and how to kind of go from utilizing my jump to utilizing force plates. That's something that I've been having the students who shadow me view ahead of time. Shout out to Dr. Zach Kushner in our Witness Point location. He filmed a fantastic kind of running gait analysis PowerPoint that we've been sending to students before they go shadow him as well. So just to kind of give the student another resource for those who aren't as, I read a journal article and I learn.
Yeah.
Well, everyone learns that way. So try to expand the modalities of offerings that we have to meet the students where they are.
Love that. Before I went into PT, I almost jumped ship and went into education because I love teaching. This is a beautiful marriage of kind of those two things. I mean, a great sports PT is a great educator. It's a great communicator, but also a great educator. You guys are really highlighting that. The ability to teach your patient, the ability to learn from your other clinicians, the ability for once you're a PT to be an outstanding CI and educator. You're really like checking a ton of boxes. It's awesome. Guys, tons of information. It sounds like an awesome program. I wish this program was around. Easiest way for students to get into this bucket. I know we hit on it earlier, but it's to what? Just send us an email.
Yeah, they can email us directly. Mine is Christie, CHRISTIE at truesportspt.com. I normally am the first line of communication with students who are looking to form affiliations with their school, or often it ends up working even better if they talk to their clinical coordinator, and then they're CC'd an email that the clinical coordinator sends to me about hopefully forming an affiliation.
Yeah, awesome. And Knobel, how do we get in touch with you?
I am Rachel K at truesportspt.com.
Okay. Guys, awesome stuff. Anything I missed? Anything you wanted to highlight?
I don't think so, no. So just be on the lookout. I'll say that it's an evolving program. You asked about pitfalls, and I think the strength and conditioning piece is new. That came from feedback from students. So that's our biggest ask of current students is come in, we want to teach you, but we also want to make our program better and better. So we do exit surveys for both CIs and students, and we take that to heart, and we're trying to grow the program as we grow both in volume and quality. So I think that's a big piece of it.
I love it. So if you are a PT student somewhere in this country, maybe even abroad, because we have a big listenership abroad, reach out to Christie, reach out to Rachel. We're trying to grow this program, improve this program, because it's not just about quantity, it's also about quality, and you guys are doing a great job. Thank you guys for your time. Everyone listening, reach out to us if you want to be a part of this program. If you want to take some of our continuing ed, we can definitely hook you up with that. The easiest way to do that is to probably DM us on Instagram, TrueSportsPT. We'll follow up. We can't wait to continue to grow this thing. Thank you guys for listening. Thank you guys for being here. Bye-bye. Bye-bye.